Let's talk about the Bulimia Nervosa OSCE station. This is a psychiatry case that often comes up, and in the next few minutes, I'm going to give you a clear, step-by-step guide to help you absolutely master it for your exam.
Welcome to this clinical walkthrough on the Bulimia Nervosa case for UKMLA, brought to you by Mediate, your 24/7 practice partner. Now, let's dive straight into the framework that's going to help you nail this station.
So, here's our roadmap for the consultation. We'll start with your approach, then move to gathering data using the SCOFF questionnaire, checking the patient impact, building a management plan, and finishing with safety netting. Following these 6 steps will keep you structured and on track.
Okay, let's start at the beginning, your initial approach. These first few moments are all about creating a safe, non-judgmental space. Here's exactly how you do that.
A great opening line is something like this. See how it's direct? It acknowledges why they're there with empathy, and really importantly, there's no hint of accusation.
Right after your opening, you have to get consent to continue. If the patient seems a little hesitant, this is the perfect time to bring up confidentiality. That's how you start building that crucial trust from the get-go.
All right, now we're getting into the core of the assessment. This is where you gather all the clinical information you need, and we're going to break it down into simple, manageable parts so it's not overwhelming.
You'll want to stick to this 4-step framework. It makes sure you cover every essential area systematically, and you won't miss anything important.
So, for the main symptom, you need to get specific details. Let's look at the key questions you need to be asking.
Getting the details on frequency, duration, and the method is so important. These questions are designed to give you exactly that information, helping you build a really clear clinical picture.
Next up, you need to understand the patient's relationship with their weight and what, if anything, they're doing to control it.
Notice how direct these questions are, especially the one about laxatives. You have to ask directly. And that last question, that's your perfect transition into exploring binging.
So, after you've gathered that initial history, your next move is to use a proper, validated screening tool to formally check for an eating disorder.
And that tool is the SCOFF questionnaire. It's essential. You need to have these 5 questions memorized, no question. Let's walk through them one by one. First up, S is for sick. You ask, do you make yourself sick because you feel uncomfortably full? This gets right to the behavior of purging. Next is C for control. Do you worry you have lost control over how much you eat? This question explores that core psychological feature, that feeling of being out of control. Then, O is for 1 stone. You ask, have you recently lost 1 stone in a 3-month period? This gives you a hard number for significant recent weight loss, which is a big red flag. The first F stands for fat. Do you believe yourself to be fat when others say you are too thin? This question is all about probing for a distorted body image. And the final F is for food. You ask, would you say that food dominates your life? This helps you understand how much the disorder is taking over their thoughts and their daily life.
The scoring is super simple. If they answer yes to 2 or more of those questions, it points to a likely eating disorder. It's a straightforward but really powerful tool.
And hey, before we move on to the management plan, just a quick reminder that you can practice this entire scenario, including using those SCOFF questions, and get objective feedback on mymediate.com.
So now that you've got a clear history, you need to figure out how all of this is actually affecting the patient's life, both in their head and in their body. You need to look at the impact across these key areas: psychological, medical, and social. Covering these gives you a complete picture. And whatever you do, do not forget to explore their ideas, concerns, and expectations, what we call ICE. This is absolutely key to a patient-centered approach. You've gathered all your data. Awesome. Now it's time to put it all together and communicate a clear management plan.
You have to explain the diagnosis clearly, without any confusing jargon. Using simple, non-judgmental language, like in this example, is the best way to do it. Your management plan has to cover all the bases. Think of these as the 4 pillars you need to talk about: investigations to check their physical health, an urgent referral to specialist services, and offering both self-help and talking therapy options. Okay, your final step. This is about providing clear safety instructions and closing the station professionally. It's a critical step that you absolutely cannot afford to miss. You need to be explicit here. Make sure the patient knows exactly what red flags mean they need to get help immediately. This is all about keeping them safe. And that's it.
That is the complete structure for the Bulimia Nervosa station. Follow these steps and you'll be well prepared. Now, go put it into action. You can practice this exact case now on mymediate.com.